Hello, my name is Meaghan Wilson, and my preceptorship site was the Pulse Heart Unit or the Cardiovascular Short Stay Unit at Tacoma General Hospital.
My name is Alona Karp, and my preceptorship was at St. Joseph Medical Center in the Ambulatory Care Unit.
The title of our poster is Evidence-Based Nursing Care of the Patient After Diagnostic Coronary Angiogram. What prompted both of our interest in this topic was actually that we both had an opportunity to see a lot of patients after catheterization for a lot of different reasons, but among the most common was diagnostic coronary angiogram, and we both thought it was very interesting. Something that surprised me as we researched was that the process of catheterization and the nursing care after seemed to be very systematic on paper, but in real life, sometimes those steps and assessments need to change a little bit. For example, if somebody is originally scheduled to do a radial catheterization, and if there's some sort of complication, they may end up having to go through the femoral access site instead. And in that case, you need to be aware of the risk factors and different assessment techniques for both of those things.
What literature helped reinforce is how relevant lower back pain is after cardiac cath. A lot of these patients are older patients with chronic back pain, and having to lay flat in bed for 4 to 6 hours is painful for them. They complain of more back pain than where the actual puncture site was, since you can't sit them up for more than 30 degrees. It's recommended to reposition them every hour or so, turn them side to side to help them be more comfortable and decrease their pain. A particular patient story that comes to mind that really reinforced the implementation part of our poster is after 6 hours of lying flat in bed, we were ready to get out of bed, ambulate to the bathroom, and see how he's doing. Halfway through, in the middle of the hallway, I noticed his leg is dripping blood. So we quickly grabbed a box of gauze pads, applied gloves, and started applying pressure to his groin site, making sure he doesn't pass out and can make it back to his bed. We carefully walked him back while applying the pressure. Then we got him in bed, kept applying pressure for about 10 minutes, and then massaging the area to prevent a hematoma from happening. Fortunately, we were able to stop the bleeding, give him some new dressing, and keep him overnight to monitor him closely.
So the takeaways of our project really involved that a diagnostic coronary angiogram is an increasingly common procedure. Coronary artery disease is also an increasingly common disease. So being aware of the early assessment techniques is really important because we're probably going to see this procedure a lot if we go into this specialty. And on that token, our nursing diagnoses all tie into bleeding in some way, but those like bleeding manifests in many different ways. For example, retroperitoneal bleeding can manifest as back pain, and blood loss can manifest as an alteration in vital signs. So your heart rate will increase, blood pressure will decrease, and sometimes with blood loss, you'll see pallor. And also, as you can see on the poster, patient education is very important. The nurses many times only see the patient for a handful of hours. So the patient and their family members should be aware of how to care for themselves in the case of an emergency after they go home. In the end, we would like to thank our clinical instructor, Dr. Meaghan Morrison, for her support through the semester. And I personally would like to thank Sabina at Tacoma General Hospital for teaching me and supporting me and being so flexible with me as I learn and transition into the nursing profession.
And I would like to give special thanks to Cami at St. Joe's for precepting me, teaching me, being patient with me, and building up my confidence to start this exciting journey as a new grad nurse.